The work that we have been doing is looking at making sure that people with dementia, when they come into the emergency department, have much better pain assessment, recognition of their pain and proper treatment for pain, so that they're not suffering and therefore becoming distressed. The process that we have used is to look at a pain assessment which is very specific to the person for dementia. So it's the Pain AD tool, and that particular tool looks at the psychosocial environment. So it looks at the body language, it looks at verbal responses, non-verbal responses, and it also looks at the clinical judgments of pain as assessed by a person with skills in pain management. So that particular tool has been very specifically provided for people with dementia, and it's very helpful not just for staff but for people who care for someone with dementia as well to use, and then to try and identify what type of pain might be present, the level of pain, and also to use as an assessment if pain relief has been given, so that you can actually determine whether or not the pain medicine has actually had a good effect. The tool itself is an evidence-based tool. It's got good psychometric properties. It has been used in a number of different situations, but we have used it for the first time in Australia in the emergency department, because as you would imagine, in an emergency department there's a lot of things happening. It's very fast-paced. People are very pressured to deal with the acute illness rather than to look more at the pain that somebody has. So the reason that we decided to undertake a trial in the emergency department was to do it under those kind of conditions, and to see if it did actually help the staff to do a good pain screen to start with, and then if pain was present to actually do a proper assessment and then to give adequate analgesia. What we found initially when we did a scoping study and a prevalence study was that people with dementia wait very much longer than any other person of their age to get pain assessment and then pain management with medicines and other treatments. So what we found was that people were waiting up to 186 minutes on average, some people waiting much longer, to get any pain assessment and to get pain management with analgesia. However, once we used the tool and we actually focused the tool on nurses who were looking after the person at the bedside, what we found is it reduced the wait time by about 60 minutes on average. Now that wasn't for everybody. Some people waited only 17 minutes, other people waited longer, but some people actually managed to do much better with good pain assessment using this tool. What we found when we did our research was that the nurses and doctors were both saying if we could include the families, the people who were staying with the person in the emergency department, to actually prompt us when they believe that pain is escalating or that pain is present, or that the medicines that are being given are not working, to please use a prompt system so they can advise us to actually come and reassess the situation. So the research we're going to be doing now is to not only educate the doctors and the nurses in this proper pain assessment, what we're going to do is to actually teach the families who are there waiting with the person a very simple prompt process based on the Pain AD tool, but very simply how to prompt, when to prompt, and when it appears that the pain levels are rising, so that we can actually get a quick action on the behalf of the nurses and the doctors. So we're hoping that that will actually improve it even more.